All right. So here's another very quick gem therapy tip. How do you find a good therapist? Well, I'm here to tell you. First of all, first tip is if your therapist is talking more than you, that is a good indication that this is not a good therapist. Therapist is a skilled listener. That means that they don't just hear, they listen. So when we give something called feedback or reflective listening, we should be able to reflect exactly what you're saying, not our interpretation of what we're saying, not our, it's not based on our frame of reference, but we are skilled listeners to be able to listen to you. So if your therapist is talking more than you and they're giving you feedback that it's not really what you're saying, run. That's not a sign of a good therapist. Number two, if your therapist does not have a treatment goal, you are not doing therapy. I'm telling you, therapy is supposed to work out the problem areas and come to some type of progress and some type of outcome that ends the therapy. So you should know what you're working on. If you are meeting with your therapist and y'all just having a good conversation and you feel good after you left, you're like, yeah, he or she really gets me, but you don't have a treatment goal, you are paying somebody to be a good friend, a good listener, but not a good therapist. Therapy requires some type of treatment goal. We prescribe talk medicine. That means that we have to be addressing some type of mental health related issue. So we have to have a goal so that we can understand whether or not we're making progress. Are we accomplishing what we came together to do? So number two, you don't have a treatment goal, you're not doing therapy. Ask your therapist what the treatment goal is. Point number three, you should know what type of talk medicine you are being prescribed. We are not just paid we have to just listen and be skilled listeners, but we have to use some type of evidence-based practice. That means that we're supposed to be doing CBT, which is cognitive behavioral therapy, MI, motivational interviewing. We might be doing EMDR, emotional mood dysregulate. I don't know. We got to be doing something. DBT, diagnostic behavioral therapy, EFST, ECO, family systemic therapy, family planning, family intervention, client-centered process. We have to know what type of talk medicine we are giving you. And guess what? You should know too. You should be able to know what the therapist is doing with you. I myself am somebody who really caters my treatment to the individual, so I might utilize all different types of evidence-based practice based on a presenting symptom. So I might do transactional analysis with one person, might do EMDR, CBT. I do CBT with everybody because we do, it's mental health. We need to change the way we think. Anyway, that's me. That's my spiel. 3 points. Remember the 3 points. If they're talking more than you and they don't seem like they're giving you feedback based on what you said, run. Number 2, if you don't have a treatment goal and you don't know what the treatment plan is, you're not doing therapy. Number 3, what is the talk medicine that they're prescribing you? You need to know you're paying for it. Your insurance is paying for it. You're not paying to be somebody's friend, okay? So that's my gem therapy tips. Please tune in. I will be talking next time, talking about some of the mental health diagnosis, trying to help you identify them so that you don't rely on somebody who's not trained and not a skilled professional telling you what to look for. I love you. Gems, keep shining. Bye.